When I first began my career back in the early 80s, lifestyle diseases such as hypertension, hypercholesterolemia, diabetes, and metabolic syndrome were already on the rise. But unfortunately, the research that connected the dots between these health conditions and disease-promoting lifestyles simply wasn't available back then. The lack of hardcore evidence on the benefits of exercise made it harder for healthcare practitioners to wrap their heads around how something as basic as exercise and an improved diet could affect so many health factors. I also personally believe that a lot of skepticism about the true benefits of exercise came from the perception that typical health club clientele were only bodybuilders, runners, and fitness fanatics. Definitely not your average American, and certainly not the deconditioned adult who was already exhibiting signs and symptoms of an inactive lifestyle. Today, healthcare providers are strongly encouraged to prescribe lifestyle medicine, like exercising on a regular basis, as the first line of therapy for both prevention and treatment of many diseases. Lack of physical activity, being overweight, or being obese are now considered among the leading health indicators that determine whether somebody is healthy or not. And your patients know all this. They've been educated by the media and already know that they have to exercise to get healthy, stay healthy, and live longer. They already know that if they want to lose weight or maintain their weight, you should exercise on a regular basis. They've also been trained and educated for the past few decades by the fitness industry that to get the exercise they need, other than doing it at home, they have to dig into their wallets and pay cash for it. There's no question. This is a proven truth your patients already know and already understand. Did you know that in 2007, 41.5 million people joined health clubs and spent over $18.5 billion on gym membership fees? Did you know that in 2009, IHRSA, the fitness industry's international trade association, forecasted that despite the tough economy, fitness club memberships would probably increase. And they actually did increase in 2009, again in 2010, and again in 2011. The fitness business appears to be one of the few recession-proof industries that is still continuing to grow. So what do we know? We know that spending money to join gyms to exercise isn't an issue here. That people, your patients, are spending a lot of their own cash to buy gym memberships and weight loss programs. And the irony of it all is that even though our economy is still in a slump, people, your patients, still keep spending money on gym memberships and diet programs. But are they getting their money's worth? Let's see. A 2007 study showed that in 2007, more than 35% of adults in the U.S. were obese. That was over 72 million people, and the study pointed out that 30 years earlier, in 1987, it was estimated that only 14% of the U.S. population was obese. And a 1997 through 2005 study showed that during that 8-year period, weight-related chronic conditions grew over 180%. Diabetes and heart disease went up by 70%. Hypertension went up by 60%. And arthritis went up nearly 50%. Of course, the healthcare costs associated with these obesity-related conditions are also skyrocketing out of control. Let me put it into perspective here. Today, it's estimated that treating obesity in the United States costs about $117 billion each year. So what's wrong with this picture? You treat these statistics every day in your practice. They're your patient base. And while you're working hard every day to help your patients achieve better health, the statistics keep getting worse. Think about it. Obesity-related diseases are up 180%. If buying health club memberships and the multi-billion-dollar diet industry curbed obesity, wouldn't these stats be dropping instead of rising? And wouldn't healthcare costs be dropping right along with them? Is it just possible the health club and weight loss industries, as we know them today, are just not the best solution for your patients. It's not that your patients aren't willing to look for a solution or they're not willing to pay for it. Statistics prove they are willing to spend their money to look better and feel better. They are willing to spend money to lose weight and be healthier. Every day your patients look to you, the person they already know and trust, for help and advice on how to lose weight, how to recapture their youth, and how to live longer. Stop depending on health clubs and gyms for the answer and sending your patients off to seek solutions from people less knowledgeable, or to struggle and ultimately do nothing because they don't know what to do. Offer them an immediate, effective, and convenient solution with a medical fitness program right at your practice. So now you're thinking, why would my patients want to participate in a medical fitness program at my office when they can join a hospital-owned facility or a big gym with lots of amenities down the street? Well, remember the old saying, give a man a fish and you feed him for a day, teach him how to fish and you feed him for a lifetime. Your patients don't want to learn how to fish on their own or even how to cook the fish on their own. They are just looking to buy the right fish sandwich from you. They don't want more information, and they don't want to be sent to a gym to have to figure it out for themselves. They want it to be easier. They want you, the person they already know and trust, to provide them with a solution, a magic bullet, a magic formula, so they won't have to figure it out for themselves. Have you ever considered how many of your patients start a diet or join an exercise facility and don't follow through after a few weeks, or maybe even after a few days? And how many of your patients are afraid or embarrassed to go it on their own at a gym? How many of your patients come back and will come back to see you over the next few weeks and months and years in the same or worse condition? You tell your patients to get into an exercise program to lose weight, and you see them nod their heads in agreement. But when they're left to their own devices, you already know that most of them won't do anything at all. Do you think your local health clubs and gyms are offering your patients a safe, efficient, results-producing exercise program on a consistent basis? Of course not. Do you think they provide the structure and accountability your patients need to achieve success on a consistent basis? Of course not. But that's the beauty of all of this. We get it, and the health club industry doesn't. And that's why this is a win-win solution for you and your patients. We know where the weaknesses are in the typical health club model. The health club industry sells fitness memberships, not personalized fitness programs. And your patients may get to use all the bells and whistles during the times the facilities are open, but there's little in the way of guidance, little in the way of motivation, and literally no accountability. There's no plan, and there's no progress checkups. They're missing the key ingredients for your patient's fitness success, and yet they're still making money and still attracting your patients because your patients have no other options. And this is where you come in, because now is the time to take advantage and fill this huge gap. It's pretty simple. Our current healthcare system is not all that it could be. Now more than ever, healthcare professionals need to take action and expand their continuum of care from not only providing disease management, but to also include programs that improve the overall health status of their patients. A medical fitness program will do just that. A successful program will provide your patients with a structured, high-quality, personalized exercise experience. And it will also be designed to remove all the barriers that discourage your patients from beginning and then following through with a lifetime fitness program. When you fulfill these two needs, your patients experience success, and the money rolls in and keeps on rolling in. Today you have a choice. You can ignore the research, the press, and the cry for help from your patients. You can send your patients away to some local gym or to the local hospital's wellness center to go it alone. Or you could participate in the $15 billion and growing lifestyle and anti-aging medicine industry. Propel your practice into the future of healthcare and become a leader in your community by offering the wellness care that your patients already want, have been paying for, and you know they need. You can have the prescription for them, a solution right inside your own practice with your own medical fitness program. The most practical, most scientifically supported, most universally accepted, and least controversial way to provide unlimited benefits to the greatest number of your patients at one time, and the easiest to continue offering on an ongoing basis. And with the right blueprint for success, you'll offer your patients a better experience and a better service than they could ever receive from the fitness industry, and you'll have your patients spend their dollars at your practice. Thanks for tuning in, and do me and your colleagues a big favor and click the like button under this video and put in a comment or two and tell others to come check us out. Stay tuned, and we'll see you in the next video.